Hello and welcome back to my YouTube channel. It's the month of March and it is Endometriosis Awareness Month. So every year, the month of March is dedicated to creating awareness for this medical condition, advocating a better diagnosis, treatment, and support to individuals that are going through this health challenge. Without much further ado, let's get to know more about this topic. Endometriosis is a medical condition in which tissues that are similar to the inner lining of the uterus, that is the endometrial tissues, grow outside of the uterus. Some of the areas where endometrial tissues can be found outside the normal location, which is the uterus, include the ovaries, fallopian tube, and the pelvis. Rarely, endometrial tissues can also grow outside of the pelvis, and then you get to see them in the lungs or in the intestines. But this is rare. In endometriosis, the tissues act like the normal period tissue. They thicken up, they break down, and they bleed. Now, during your period, as endometrial lining is being shed off, which is the regular period you see, these tissues in other sites, in the ovaries, in the fallopian tube, and in the pelvis, they are also being shed off as blood, as period, right? However, they cannot be expelled out just like your period, which is expelled out through the cervix and then out from the vagina. These tissues in the ovaries, fallopian tube, and the pelvis, even though they bleed, they can't be shed off, and so they tend to accumulate and thicken, leading to pain, scarring, and sometimes formation of cysts in the ovaries, what is known as endometrioma. The disease condition affects approximately 10% of women of the reproductive age group. So for every gathering of 10 women, one of them is affected with this condition. However, this number isn't so accurate, and that is because the disease condition is quite difficult to diagnose. So the number might actually be larger. The exact causes of endometriosis isn't known. However, here are some. The first we'll be talking about is retrograde menstruation. So usually the period blood flows from the uterus through the cervix and out of the body via the vagina. But in retrograde menstruation, it is otherwise. The reverse is the case. Now the blood flows or moves from the uterus into the fallopian tube and then to the ovaries down into the pelvic cavity. In the pelvic cavity, this blood gets to accumulate and thickens up, and then over the course of each period, it tends to bleed, resulting in the pain and scarring associated with this medical condition. The next cause is genetics. If a first degree relative such as your mom or your sibling has endometriosis, then there is a higher tendency that you might also have endometriosis. The next is immune system condition. Now, a problem with the immune system makes the body unable to recognize and destroy these endometriosis tissue, leading to endometriosis. Some of the risk factors of endometriosis include early menarche, that is seeing your first period at a very young age. Another risk factor is short menstrual cycle length. If your menstrual cycle length is less than 27 days, then you're at the risk of having endometriosis. If you've never put to bed, if you have a low body mass index, or you experience every menstrual period that lasts longer than 7 days, you're at risk of having endometriosis. Also, having a first degree relative such as your mom or your sister can also put you at risk of having endometriosis. The main symptom of endometriosis is pelvic pain, and usually this pelvic pain is often associated with period pain. Hence, the first symptom we're talking about is painful period. If you experience excruciating pelvic and stomach pain before or during your period that may or may not be associated with the lower back pain, this could be a pointer to endometriosis. Also, pain during or after sexual intercourse, or pain during bowel movements, painful urination, difficulty in conceiving or difficulty in getting pregnant are some of the symptoms of endometriosis. So for some women, they do not know that they even have this medical condition except when undergoing tests for infertility. Also, irregular menstrual period as well as heavy menstrual bleeding could also be a pointer to endometriosis. Firstly, the diagnosis of endometriosis is quite difficult, and this is because the disease condition is usually mistaken for normal period pain, hence the reason for lesser diagnosis, and it takes about 7 to 10 years to actually diagnose this medical condition. Some of the ways endometriosis can be diagnosed include the symptoms the patient is having, 2, a pelvic examination to look at the pelvis and see if there are actually signs of endometriosis, and then lastly is investigations. Some of the investigations that can be done to actually diagnose endometriosis include a pelvic ultrasound scan, an MRI, and a laparoscopy. And this laparoscopy involves the doctor putting something that looks like a camera into the abdomen to actually check if there are presence of endometrial tissues. The treatment options available for endometriosis include medical treatment, surgical treatment, and fertility treatment. Now, the medical treatment is the use of drugs, and the first class of drugs we'll be talking about is the non-steroidal anti-inflammatory drugs. An example is your ibuprofen, your naproxen. However, you shouldn't use this drug without a doctor's prescription. There are some contraindications to using this drug. If you want to know more about these contraindications to NSAIDs, then please check out my last video on causes of painful period, that is dysmenorrhea. You're going to find some of the contraindications to the use of NSAID. Number 2 drug we'll be talking about is the use of hormonal replacement drugs, such as the use of birth control pills, hormonal IUDs, and gonadotropin releasing hormone agonists. An example is your leuprolide. This particular drug help to prevent or slow down the growth of the endometrial tissues. These are some of the drugs that can be used to manage this condition, not cure it. It can be used to manage some of the symptoms associated with endometriosis. The next treatment option available is surgical, and we have the laparoscopic surgery, which involves removal of lesions and scar tissue in severe cases. Another surgical procedure that can be done is an hysterectomy, which involves the removal of the uterus. However, this is rarely done. And then lastly is fertility treatment. If the endometriosis is like moderate to severe and it's affecting you from conceiving, then you should undergo a fertility treatment, and one of the best options is an in vitro fertilization. One of the main complications of endometriosis is infertility. About 50% of women dealing with endometriosis have difficulty in conceiving, and this is because sometimes the endometrial tissues blocks the fallopian tube, making it difficult from the sperm to meet the egg, and so fertilization does not occur, and then there is no pregnancy. Another complication that can occur with endometriosis, though rare, is an ovarian cancer. Okay, so when to see a doctor? You need to see a doctor if the pain becomes very unbearable, if you've tried several painkillers and you still feel that excruciating pain, if you have pain while having sex, if you have difficulty in conceiving, or if you even like tell people about the severity of the pain and they keep dismissing you, then you should see a doctor. In conclusion, endometriosis is a complex and often misunderstood medical condition that affects millions of women worldwide. While it currently has no definitive cure, early diagnosis, proper medical treatment, and lifestyle modification can help improve the quality of life. If you or someone you know experience any of these symptoms of endometriosis, please do not hesitate to seek medical advice. Thank you so much for watching today's video. I believe that you have learned something new. Please do not forget to give this video a thumbs up. Don't forget to comment, share, and if you have not subscribed to my YouTube channel, please do subscribe. Thank you so much for watching, and see you in my next video.